it's a new 2-minute warning.
For real 2 minutes.
Yes.
They're walking
in right now. Walking in right now. They're standing right outside the function. Here we go. Here we go.
Good morning. My name is James Appa. I'm Communications Director for Public Health, Seattle and King County. Here today to give you an update on COVID-19 response in King County. Today you'll be hearing from King County Executive Dale Constantine, Patty Hayes, Director for Public Health, Seattle and King County, Dr. Jeff Duchin, Health Officer for Public Health, Seattle and King County, Dr. Kathy Lofi, Washington State Health Officer, Dr. Ettore Palazzo, Chief Medical and Quality Control Officer for Evergreen Health. Also available for questions will be Dr. Com Clark, who's the Deputy Director of CDC's Division of Viral Diseases, and also Dr. Chris Balaga, Section Head of Infectious Diseases for Virginia Mason Medical Center. We will be handing out the media release associated with this during the conference. We will also have a detailed list for you of all the cases to date that we are going to be announcing. So those will be handed out shortly. But at this point, I'd like to turn it over to Executive Constantine.
Thank you, James. I want to express my gratitude for the incredible work being done across King County to keep people safe and to provide the latest information to the public. And I'd also like to extend my condolences to the families of those who have lost their lives. These are our friends, our neighbors. The people of King County are united in their concern for those who are ill and for those who've lost a loved one. We have moved to a new stage in the fight to contain, mitigate, and manage this outbreak. On Sunday, yesterday, I signed a declaration, an emergency declaration, which enables me to take extraordinary measures, including waiving some procurement protocols and authorizing overtime for King County employees who can be deployed to the fight against coronavirus, among other powers. This morning, we are in final negotiations to purchase a motel in which we can place patients who are in need of isolation and a place to recover. We're going to be able to provide additional information on the location later. We have not yet completed the transaction, but my real estate people tell me that it is all but done, and we should have it available for patients by the end of this week. In addition, we're going to be setting up modular housing in several locations around the county, including Seattle. These are primarily units that formerly housed oil workers in the oil fields of Texas, and we purchased them to bring them here to Seattle and to rehab them in order to serve the homeless population. In fact, that's how we set up Eagle Village, which is a shelter complex specifically designed to serve Native Americans and Alaska Natives who are without a home, and it's in the Soto neighborhood of Seattle. 14 similar modular units are currently in storage at our facility on Harbor Island. And depending on the medical condition of the people there, it could house over 100 people. We have, in addition to that, newly manufactured modular units at a facility in Marysville. And those were in the permitting process to site those for the use for housing for those who are formerly homeless. We're going to be pressing those units into service as well and identifying sites where we can locate those for isolation, recovery, et cetera. Currently, we have identified multiple sites for these facilities, and we're confirming their feasibility quickly today. We expect more locations to come online shortly. We continue to plan for all contingencies across all King County departments, and we are working closely with our 39 cities to set up their local response. Leading this effort is King County Public Health. And for an update on the latest case count and actions, I want to turn it over first to Director Patty Hayes.
Thank you so much, Dal. I'm grateful for your action in support of our community and for your continued extraordinary support of our response to the outbreak. First, I want to add my voice to Dal's to send our deepest condolences to the loved ones of those who have passed, and our heartfelt thoughts to those who are seriously ill. This is such a tragic and difficult time for these families, these communities. Our entire community has them in our hearts and wishes them strength as they bear this. Today, I'm wearing my pin that represents nursing and the work of healthcare workers in honor of all the folks that are out on the front line, in honor of Florence Nightingale. You know, we know that the vast majority of people who are going to be infected by this virus will not have serious illness. But those who do, our healthcare workers, will do and are doing everything to help manage patients in need. In turn, we need to do everything to help those healthcare workers. I'm asking the public to do things like saving masks for our healthcare workers. I know there's been an incredible run on the sale of masks. We need assets for our healthcare frontline workers and also for those who may be needing them and are not feeling well, so they want to protect themselves, or those who culturally use them. Masks are not generally recommended for healthy people to prevent infection, but they're so important for these other uses that I've mentioned. We face this challenge now, but I want you to know that I feel we have the best people in the world here in King County to respond to it, including a great team for the Centers for Disease Control that arrived, and we have another team coming this afternoon. We will get through this by staying informed and united. And as you'll hear, there are things that every one of us can do to control and reduce the impact of the disease in our community. With new information now, I want to turn this over to Dr. Jeff Duchin to give you that latest information and what we're doing right now. Jeff?
Thank you, Patty. Jeff Duchin, Health Officer, Public Health, Seattle and King County. And I also want to extend my sincere sympathy and condolences to the families of the patients who have died and those who are ill. Over the weekend, we reported 6 cases and 2 deaths in King County residents, reporting 4 new cases today. And of these 4 new cases, 2 have died. In addition, one of our previously reported patients has died. This brings the total number of cases to 14, including 5 deaths total. These are the new cases. A male in his 50s who is hospitalized at Highline Hospital with no known exposures. A female in her 80s, a resident of Life Care, who is hospitalized at Evergreen Health. A male in his 70s, a resident of Life Care, who is hospitalized at Evergreen Health. This man had underlying health conditions and died on the 1st of March. A female in her 70s, a resident of Life Care, hospitalized at Evergreen Health. This woman had underlying health conditions and died on the 1st of March. In addition, a woman in her 80s who was previously reported by us as a case in critical condition at Evergreen Health has also died on the 1st of March. As you are undoubtedly observing, this is a complex and unprecedented challenge locally, nationally, and globally. I'm very grateful to what our frontline healthcare providers are doing to treat these patients and the number of patients that we know they will continue to see over the coming weeks and months. I'm also grateful to our colleagues at Washington State Department of Health and from the U.S. Centers for Disease Control and Prevention. A team arrived last night. We have now 17 CDC members here helping us with infection control, epidemiology, contact tracing, and understanding the impact of the early stages of this outbreak in our community so that we can plan for the days and weeks and months ahead. Now, it's very important for everyone to remember that the vast majority of people who are infected with COVID-19 have a mild or moderate disease and do not need hospitalizations. On the other hand, it's obvious from what we've just discussed that this infection can cause very serious disease in people, particularly people who are older and have underlying health conditions. We expect the number of cases will continue to increase in the coming days and weeks, and we're taking this situation extremely seriously. The risk for all of us of becoming infected will be increasing. And although most of the cases will be mild or moderate, the infection can cause serious illness, and there's a potential for many people to become ill at the same time. If this happens, it can be disruptive both to our lives as individuals, to our communities, and to our healthcare system. And we want individuals to know that there are things that they can do and steps that we can all take as a community to decrease our risk of becoming ill personally and to decrease the number of people who become ill in our community and minimize the disruption that we will see from the numbers of ill people at the same time and decrease the impact on our healthcare system to the greatest extent possible by reducing our individual risk. So we are making both individual and community level recommendations to limit the spread of this disease. And our community level recommendations are very similar to what we recommend for influenza. And we'll talk a little bit more about that. So again, the most important steps that individuals can take to improve their health and decrease their risk of getting sick currently are basic hand hygiene. Wash your hands frequently. More hand washing, less face touching. Avoid contact with ill persons. And if you yourself are ill, please don't go to work or school until you're well. It's really a good idea at this point, at this time, for everyone to be familiar with what pandemic preparedness is. There's great information out available on the web for individuals, schools, and communities about how to prepare for a time when many people may be ill and you want to minimize your interactions in the public, your interactions with other people, the number of things that you touch on a daily basis and stay home and away from others as much as possible. So that involves having a home preparedness kit and understanding how you might take care of people in your home who become ill. If there are elders or seniors who are dependent on you for health, how they will get their, or dependent on you for care, how they will get their care if you become ill, who will care for children, what you will do if schools are closed for a period. All of this is very important for people to become familiar with now so that they're best prepared as we see more cases in the community over the coming weeks or months. We also want to provide as much information as we can that will help people make informed choices and good decisions on an individual level to protect their health. So, for example, as we see more cases coming into the community, to protect your health, people should consider avoiding crowded settings to the extent possible. This is especially important for people who are at higher risk for infection, people over 60 years of age and people who have underlying chronic health conditions. Very much the same as we advise during influenza season to people who have high-risk conditions. Try and avoid exposure to influenza by avoiding close contact with others and having good hand and respiratory hygiene. The same measures are very relevant now in the context of the COVID-19 outbreak. We're not recommending everyone avoid crowds and public settings at this time, but we want the information to be out there for those who can make good, informed choices about their own individual health and the risks and benefits to themselves. We understand people need to be out in the community. We all need to do things. There's value to social interaction, and based on the level of disease in our community now, we're not recommending widespread cancellations of gatherings or closures of schools. But we do want people to know that this infection is with us and it's going to be increasing, and there are things they can do to decrease their risk. And right now, if you're a susceptible person, someone who's got underlying health conditions or is older, you might want to take steps to avoid exposure to this virus that we haven't recommended for everyone at this point. We also want to remind people not to go to the emergency department unless they really need to be, unless they have an urgent health issue. Our emergency departments really need to take care of those who have critical illnesses and emergencies. And if you've got an illness like cough, fever, flu-like symptoms, it's better to contact your healthcare provider and get advice about how to manage your illness than go to an emergency room where there will be lots of ill people in the waiting room, long waits, and most likely you won't need to be there if you've got a run-of-the-mill flu-like illness. I also want to mention that we are not recommending school closures or cancellation of any activities at schools at this point. We have no confirmed COVID-19 cases in our school community, and if we do, we'll work directly with that community to provide guidance. Schools don't need to take any special precautions beyond what we've recommended for good hygiene, recommendations to keep ill students and staff out of school, and routine environmental cleaning, and we recommend they review those guidelines that are on our website, on the Department of Health's website, on the website of the Centers for Disease Control and Prevention. At this point, I want to thank Director Hayes again and our healthcare workers and first responders for we recognize the incredible work that you're all doing, that you're providing an essential service to all of us in our community. We very much appreciate that and the collaboration as we work together to meet this challenge that will be increasing over the coming days to weeks. I'd now like to turn the podium over to Dr. Kathy Lofi, our State Health Officer.
Well, thank you, Dr. Duchin, and good morning, everyone. My name is Dr. Kathy Lofi. I am the State Health Officer at the Washington State Department of Health, and I want to give you a little bit of an update on the statewide situation. But first of all, I also want to say that my heart goes out to all the families of the loved ones who we have lost to COVID-19. Unfortunately, we are now starting to find more COVID-19 cases in Washington that appear to be acquired locally here in Washington. And we now know that the virus is actively spreading in some communities here in Washington. We currently have 18 COVID cases that have been identified here in Washington. King County has had 14 cases, including 5 deaths, and Snohomish County has had 4 cases. At this time, we have not detected COVID-19 cases outside of King and Snohomish counties, but given the movement of people around our state, it is possible the virus is spreading in other counties too. We've been working really hard to increase our testing capacity at the public health laboratories. Our state public health laboratory now has the capacity to test about 200 specimens a day, and we are keeping up with these requests. In addition, we have been really working hard with our commercial laboratory partners so that we can bring other clinical laboratories online to perform this test as well. And I'm happy to announce that the University of Washington is going to start testing for COVID-19 either today or tomorrow, and that will add tremendous capacity for testing here in our state. Additional testing will help us find more cases and allow us to better understand the risk of COVID-19 in communities throughout the state. And we are very committed to reporting all the information we have about positive tests in a timely fashion so that people can make good decisions about their health. So I just want to echo a few of the points that Dr. Duchin just made about steps we can all take to prevent illness. He mentioned wash your hands often. You can also carry an alcohol-based hand sanitizer around in case soap and water is not available, and I now do carry alcohol hand sanitizer with me. I also wanted to just talk a little bit about avoiding touching your eyes, nose, and mouth with hands that are not clean. This is really hard to do. We all unconsciously do it throughout the whole day. And there have been studies that have looked at just how many times people touch their face, and it's a lot. So we all really need to think, about how we can consciously avoid touching our face. And then lastly, I just wanted to talk about staying at home and away from others, if you're feeling sick. I know that we've all gone to work when we've been sick. And we all feel responsible to our work colleagues, and we want to be a committed member of our work team. And some people, it may be very difficult to take time away from work, but we need to do all we can to protect each other at this time. In addition, as Dr. Duchin mentioned, if people want to further reduce their risk of COVID-19, they can consider avoiding crowded settings, particularly people who are older and people who have chronic health conditions. So we understand the concern that people are feeling about the situation here in Washington. All of us want to ensure ourselves and our loved ones are safe and protected. I want to expand a little bit around preparedness. Dr. Duchin talked about the need for us all to be prepared. Some simple things you can do now is make sure that you have food and basic supplies like medicine at home, like the same kinds of things that we would recommend that people keep in stock in case of other emergencies, like a power outage or an earthquake. Think about what you might need to do to make alternate plans for childcare. Talk to your employer about options for sick leave and telework. We have a lot of technology now, and now's the time to be able to take advantage of some of that technology if your work allows it. As the situation continues, local health authorities may make recommendations to cancel community events or close schools, but individuals still need to make personal decisions. We're committed to sharing really accurate, timely information, as I said, so continue to watch the Department of Health website for more information about testing results. And I'll also just reiterate that it's important to remember that most people with COVID-19 have mild illness, but as we are now acutely aware, a small portion will have very severe illness, and that is why we are working so hard to try to decrease the spread of this virus here in Washington. And with that, I'm going to introduce Dr. Palazzo.
Thank you, Dr. Lofi. I am Tori Palazzo, the Chief Medical and Quality Officer at Evergreen Health in Kirkland. A lot has happened in the last 72 hours since we learned of our first positive case of COVID-19. Before going any further, I first want to simply say that the organization is extremely grateful for the outreach and support that we have received from not just the local communities, but across the nation. And it is quite humbling for myself and the entire staff at Evergreen Health to receive that support. I also want to thank the Washington State Department of Health, our colleagues here at King County, Seattle Public Health for all the support, and of course the CDC as they help us and guide us on this journey. We started our testing protocol and identification of COVID-19 last week following the CDC guideline changes at that time. When we were alerted of our cases, we went ahead and followed those recommendations, and those patients went into appropriate precautions and appropriate monitoring, and all care providers working with them following the appropriate precautions as well. We now, at this time, have 10 confirmed cases of COVID-19 at Evergreen. Despite our best efforts, 6 of those cases have died, and our condolences go out to the patients' families in this time.
Sorry, you said 6.
I did, and so I'll note that one of our patients is a Snohomish County resident as well. So we have, as I understand it, and my colleagues will help correct me if I'm incorrect, this is the data that we have, that 5 of our cases that had died are King County residents. We do have one that is a Snohomish County resident.
There's 6 deaths in all in the state. Is that correct?
As of this morning at Evergreen Health, we have 6 deaths with positive coronavirus.
Maybe after Dr. Palazzo's finished, Dr. Lowe, if you can clarify the state numbers.
Please.
Very good. So at this time, along with our current confirmed cases, we have approximately 29 cases that are pending investigation total, and we are waiting for those results, and those patients are in appropriate precautions, and staff caring for those patients are following all the appropriate CDC precautions there. We have made adjustments at the organization to allow for airborne precautions. We are in a situation where we're able to convert our entire critical care unit over to a negative pressure scenario so we can keep those patients and staff caring for the patients safe, and we have those capabilities in other areas of the hospital as well. At this time, our staff are making adjustments to care for the patients, and that is going as well as can be expected at this time. Again, I want to thank the support of the community, thank all of the staff at Evergreen Health for their work, and everyone that's working to get us through this time. I'll go ahead and hand over to...
Let's have Kathy come back up and...
Sure.
Yes, so 6 should be the correct number. We were at the department aware of the 5 deaths from King County. We had not received the report about the Snohomish County patient just yet, so everything gets kind of reported up the chain. So, yep, apologize for that.
And all those deaths have been at Evergreen? Is that correct?
We have had 6 deaths at Evergreen.
So do you want to have Jen?
Yeah, I think at this point I'll go ahead and hand off to Dr. Duchin. He can continue discussion.
Thank you. I want to emphasize one point here, and you know, our colleagues at Evergreen have been very aggressive about testing seriously ill people with unexplained pneumonia, which is a new criteria for testing. And we're now identifying patients that weren't able to have been tested before. So I don't want you to get the impression that, you know, there's these cases are necessarily occurring right now. They're being tested right now. So they have probably been occurring for a while. And as you know, we haven't had the ability to test for mild cases until this week, basically, with this new lab capacity that's coming online at the University of Washington. So you should understand that there are likely many mild cases in the community that we're not aware of. The cases that our healthcare system colleagues like Evergreen Health are finding are those tip of the iceberg patients that are hospitalized with severe illness. So it's important to understand that the vast majority of these cases that are mild are going undetected. But the other thing I think it's important to understand is that What you just heard illustrates the challenge of this disease. This is like a severe influenza. It drives many people into hospitals. It causes many of us to feel sick and stay home, many more than go to hospitals. But as you can imagine, the public health system and the clinical healthcare delivery system do not have the capacity to track down every case of influenza in the community. And we're going to be probably, my guess, seeing more cases of coronavirus than we see of influenza over the coming weeks to months. So at some point, we're going to be shifting our approach from counting every case to focusing on outbreaks, perhaps cases that occur in hospitals, and we won't be able to do the kind of individual case follow-up and case management that we're doing early on during this so-called containment phase of the epidemic. And we are still trying to contain to the greatest extent possible. But at the same time, we're pivoting towards a more community-based approach, very similar to what we use for influenza epidemics, where we give people and schools and businesses good advice on how to protect themselves, how to minimize illness in their students, staff, how to minimize risk at work, and we understand that people still need to carry on with their lives, just like we do during influenza season. So we give people good advice on how they can reduce their risk, how they can manage if they do get sick, but it will be very important for everyone to understand that we're going to see a lot of sick people, and we're going to have a tremendous challenge on our healthcare system, and we're not going to be continuing to try and focus on every case, and that case is contacts. We'll give people good advice on what to do when they're sick, how to prevent illness from spreading, but again, it's not going to be that individual case follow-up. Just I wanted you to understand that's where we're headed. Dow, did you want to make additional comments?
No, I'm just going to ask some questions. So, Jeff, stay close. We're going to open it for questions. I just want to make note of a couple things. I wanted to thank Councilmember Reagan Dunn for being here in support today. I've received your strong messages of support and solidarity in our efforts, and I appreciate it. I also received a call from Senator Patty Murray this morning expressing her support, seeking information about how she can further help. And she is busy fighting to ensure that federal funding includes funding for local agencies and this local response, as well as that money directed by the federal government is able to go to hotspots around the country. She's very much in tune with this and very personally engaged as she's from communities nearby here originally and has family members across many of the areas affected. I'm going to ask if you have questions to direct them to the right person here, and then we're going to have some follow-up about the items I talked about, additional capacity for people to be isolated, et cetera. James?
Yes. Before we go to questions, we're now going to hand out the release and the individual, with the list of the individual cases, so we can answer your questions around that.
Dr. Lucci, is there a commonality here in terms of underlying conditions? I understand you have privacy. We now have a number of tests. Can you talk about the kinds of underlying conditions that you're seeing?
Well, in general terms, I can. I mean, again, this is a very small number of people we're dealing with, 14, so it's hard to generalize, but I can say that, people who have chronic lung disease, chronic cardiac disease, diabetes, the same types of chronic conditions to a great extent that we worry about with influenza seem to be at increased risk for this disease. Now, again, this disease wasn't even known to us 2 months ago, so we're still learning a lot about specific risk factors for disease, spectrum of disease, how severe it really is, how many people get seriously ill, how many have mild illness. So it's apparent from what's been reported from China and from what we're seeing here locally that the patients who are having serious illness are those who are either very old with weakened immune systems due to age, or have underlying chronic diseases. But there are too few patients to say specifically whether one underlying condition is more of a risk factor than another at this point.
Can you say whether we have capacity with our ICUs in the area to handle an influx of lots of very sick patients? Are we going to bring in more equipment, ventilators?
Yes, so excellent question. This disease will pose a significant challenge to the healthcare delivery system across the country and across the world. And our healthcare delivery system is rather well coordinated. We have the Northwest Healthcare Response Network, which helps our system with resource allocation, sharing of resources, prioritization of resources during surge times, and we've done a significant amount of planning with them, so they are prepared to make available as many beds and intensive care beds as they can. They've been thinking forward about this since the outbreak occurred. So it's impossible for me to predict, what the peak of this outbreak will be, and everything we're doing now is trying to blunt that peak and push it down by giving people advice on how to protect themselves from becoming ill and not running into the hospital if they're not seriously ill, to preserve those limited resources for those who really need them. But I can tell you that even this early in the outbreak, our hospitals are feeling the strain. And I would refer you either to Dr. Plazzo, who may want to comment about Evergreen, or Dr. Balaga, who can talk about his experience at Virginia Mason, or you can reach out to the network, to hear some of what they're experiencing.
Do we have capacity, though?
We have capacity. The question, what we don't know is what the supply and demand is going to be ultimately.
Would you mind giving the ages and information on the subjects?
I'm sorry, I don't. What's the question?
Information on the people who have died. Could you repeat that one more time?
Okay. I have, James, the handout has information on.
The handout doesn't have information on
There's another handout going around that has all of the information about the cases.
It's missing some dates of death. And we wanted to ask if the folks who have died, how many are linked exactly to the, if you know, to the life care facility?
Mm-hmm. Yeah. So as you know, we have an outbreak at the long-term care facility, Life Care in Kirkland, and I just wanted acknowledge the incredible work that organization and their frontline healthcare workers are doing to both keep those residents safe, but also keep their healthcare workers safe. We've had staff on the ground with them. We have our CDC colleagues working with them to make sure they've got the best infection control guidance and are taking all the recommendations that we can possibly provide to keep their staff and their patients healthy. And we really appreciate their dedication. They're working very hard and very long hours, and we know it's stressful for them. So of the 14 cases that we're reporting, 8 have been linked to Life Care. And of the 5 deaths that we've reported, 4 have been linked to Life Care.
And the other 2, do we know the sources or links?
There's one additional death that was unrelated to Life Care.
Executive Constantine mentioned modular housing for homeless populations.
Mm-hmm.
Is there a stage 2 plan for if more individuals who are homeless become infected? What happens after those 100 or so?
Yeah, clearly we're very concerned about, many of us can shelter in place. We can go home. We can even work remotely. That is not an option for people who are unhoused. The challenge is making sure that people who become infected aren't in shelter and causing infection to others, and that they have a safe place to be in isolation or quarantine or recovery. We are standing up capacity, which we believe will be sufficient in the short term, but we're going to continue to push to create capacity because, one, we want to make sure those who don't have housing have an appropriate place to be, and 2, we want to make sure that hospital capacity is not being taken for people who need only to be in isolation or to be in recovery. We need the hospital capacity for people who need treatment now. And so our facilities division is working very hard to site as many appropriate units as possible, and we're going to continue to push that real estate effort.
Executive Constantine, when it comes to those homeless camps, there were outbreaks of things like hepatitis that was reported in April. We have different people with the flu and things like that. Why is there now a sudden concern for the population when it comes to the coronavirus?
Each of those epidemics or those outbreaks is obviously a concern. The coronavirus is, novel by name. It's different. We don't know the shape of it yet, the way in which it spreads, or the seriousness in terms of who will be affected and how badly they will be affected. So our public health folks can talk about the similarities and the differences between those different diseases, but I think that we are all recognizing that in the case of a global pandemic where very little is known, where no one has natural immunity, where there is no immunization and there's no specific known treatment. We need to take it most seriously and to take extraordinary measures, including moving resources quickly from other areas in order to provide the ability to isolate people and give them the opportunity to recover without infecting others.
Dr. Duchin, there's a question about testing. You had brought up testing a couple of times,
Sure.
and how that changed with the CDC mandate. So,
Not mandate. They produce guidelines that we follow.
Those guidelines.
Yeah.
What changed in King County? I mean, are we talking about now? Put it in layman's terms. Are we talking about now that the numbers are going up because the testing is better? What happened prior to that?
Right. So there's a couple of. So let me give you the history on the testing situation. When testing first became available, it was limited, and it still is limited to some degree. And because of that, we had to prioritize who we could test with our limited resources. So we were, the guidance was, and we followed, to test patients who had the most serious illnesses, the hospitalized patients, because we thought it was, and we still think, it's most important to identify patients who are critically ill and don't have another explanation, and those who have a risk factor for having novel coronavirus disease, so someone who had a link to a known case or a travel to an area where an outbreak was occurring. But as more testing capacity becomes available, we can test more people who are, and that means people who are not critically ill. So people who might be in the community who aren't sick enough to require hospitalization. And as we begin to test, so we had this surge in patients recognized last week as we started to test, we found out that in fact, this virus has been in our community, obviously, and it's made people sick, and we are now recognizing that because we're looking for it. And the more we look for it, the more we're going to find it, and we're mostly going to find it when we have the ability in people who are not very sick and people who have mild flu-like illnesses. And so as the University of Washington and as commercial laboratories start making this test more widely available, we'll see it being used just the way we see influenza testing being used. That someone goes into the doctor with a cough or a cold, gets tested on the premises, doesn't need to be admitted to a hospital like you did initially for this COVID-19 disease, and can get a result. And this disease will need to be managed much like we manage a seasonal influenza. Many people will have it. Most people will not be seriously ill, but we want to do two things. We want to protect those who are most at risk for becoming seriously ill, and we want to prevent many people, as many as we can, from becoming sick at the same time. So these social distancing measures, keeping people as far apart as is practical, acknowledging that we still have to go on with our lives and our community, but to the extent that we can limit our interactions, we will be decreasing our risk of getting sick and decreasing the number of people that need to see healthcare providers and enter our hospitals until this epidemic passes. So as we test more, we will see more. Some of that is due to cases that were already here but not recognized, and some of that will be due to new transmissions that are occurring in the future.
Dr. Duchin, what are you looking for that will make you say, now is the time that we're going to cancel public events? What sort of level of cases over what period?
Yeah, that is an area of active discussion nationally now, the so-called triggers for doing the community mitigation guidance. We certainly are beginning to think very hard about that this week, because we have these recognized cases in the healthcare facilities, and we believe that there are cases in the community. So we're going to be looking at our measures. We'll be looking for the extent of community transmission, the evidence that we have for the extent of community transmission, not, for example, focused on one facility, but in multiple spaces, multiple locations in the community. And then a key issue, again, is severity of disease. Right now, people may be getting the impression this is a disease that makes everybody seriously ill. That's just the opposite of what it actually does. It makes most people mildly ill, moderately perhaps, and just the tip of the iceberg, but the ones that we happen to be looking for currently are seriously ill. So we want to get a good sense of how severe this illness is, and particularly we'd like to learn as much as we can about the role of young people in either spreading this infection or getting sick themselves, so we can think about the school issue, school closures and dismissals. As you know, a lot of the community mitigation guidance is disruptive. I mean, we should be prepared for disruption in the community if we tell people not to go to work, not to go to school. And so we have to really carefully weigh the risks and benefits. There are so many unknowns in this outbreak right now. We don't know exactly when's the right time to implement it. We don't know exactly how long do we need to keep schools closed or tell people they can't go to work. The idea is to lessen the impact. We know we can't prevent the outbreak. So as we get more information from our colleagues in the healthcare system about the number of ill people coming in, the severity of illness, work with our CDC colleagues and some of our epidemic modelers about the appropriate timing, we'll be making decisions. And I think you can expect over the next 2 weeks probably to hear more from us about community mitigation measures and what we might think are the right time to do it. As I said, we can't expect people to go for months and months, without school and without being able to go to work or telecommute necessarily. So we want to make sure that what we do is reasonable, that it's something that's acceptable to the public, that they feel like it's worth it to keep our community healthy, and that the timing and the duration are right. And all of this in the face of tremendous uncertainty, about the benefits of doing anything at a specific time or a specific duration. So we're going to be making judgments based on the values of our community and our leadership, and knowing that the benefit and the risks are all really not clear at this point.
Okay, so we need to get Dr. Duchin and our responders back as soon as possible to their work. We'll take 3 more questions. So,
can somebody speak to, there's a lot of parents out there that are pushing for school closures who are worried. Can someone say something to them?
Thank you.
So we are indeed getting a lot of calls from both schools and from parents. The team upstairs has been individually working with superintendents. The schools, of course, out of an abundance of caution, have the right, the authority to close if they want to clean it. We've had a number of examples of that. Our commitment to our team in terms of supporting the decisions being made by schools is that we're working with them to assess the level of risk, and they know particularly their school. As you heard, we don't have an outbreak linked yet, and as Dr. Duchin said, when that occurs, of course, things will pivot, our message will pivot, we will deploy more attention to that school and those parents, et cetera. So we're standing up a call center today, and that number will be made available, and we really believe that that's an important link for that as we make sure that as superintendents have questions, as school teachers who have had students in areas, or as, say, a healthcare worker program from one of the local technical colleges has had students, that we're able to give them the best advice on when do they need to, if they had students in a facility, when do they need to do something. So again, this is going to evolve as we get a better picture, but right now we're trying to answer and get back to those superintendents as fast as possible. As you can well imagine, our phones upstairs are off the hook. We are getting all what we need to do with the support of the executive to set up this call center so we can triage it better. Kathy, do you want to say something about the state call center?
Oh, sure.
Yeah, so we also have a call center available at the state level, and I'm just grabbing the number for you. It's in my notes somewhere. And the number is 1-800-525-0127. It is our COVID-19 hotline, 1-800-525-0127.
Do we have the latest of the patients from the Life Care Center? For the rest of them that are still in there, being in kind of that isolation area, do we know kind of any latest information on them? Not the ones that are in Evergreen Health, but the ones that are still at the center when for many visitors and things like that from visiting.
Yeah. So thanks for the question. So we've had, and I think today also, we have staff out there today also, Life care, yeah. Yesterday on the ground, our team with CDC back today, supporting the life care staff as they're taking care of the patients that are in the center. They'll continue to provide care, and as if those patients need to be hospitalized, they will be. But does that answer your question? I'm not exactly sure you're getting at.
I was just interested what was because there were, I think, 50 or so who were.
Yeah, you're right. They're still caring for a large number of patients, and they're doing so with really good support. And we're grateful to them, and we're going to continue to support them to the extent that we can to prevent their staff and their patients from getting sick and keeping them healthy.
So one final question.
Some clarity on the 6 deaths. We got some information. We didn't get information on the person from Snohomish County, and also we got information that all 6 deaths happened at Evergreen, but then in the beginning it was said that someone was hospitalized at Highline. So could someone please run through the deaths again?
So the run-through is on the release you have in front of you. Pardon? So we will provide additional clarity, and we'll post it on our web. I appreciate everyone's interest in this information. We are getting the information very quickly in real time as well.
14 cases in Washington, right? And 8 of those cases have been linked to life care, including 4 of the 6 deaths, right?
So I'm going to refer you back to the sheet, and then we will update our website with updated information as we receive it. So what we can provide you is the release right now with our information. Snohomish County can report their own cases individually. And we will have an update on our website with all the information.
But the Snohomish County person died at Evergreen, is that correct? That was the 6th death?
That is correct.
Did they all die in Kirkland?
They all died at Evergreen.
Yes.
Well, except for the one who died at Highline, it's not, right?
They're not dead?
But there's not a death at Highline.
So you said there was 1 death as the person in the 50s who was hospitalized in Highline. Is that correct?
Yeah, that's incorrect. The new cases that we announced today included a male in his 50s hospitalized at Highline. This gentleman has no known exposures, no link to Evergreen, no link to the skilled nursing facility, Life Care, and he is in the hospital at Highline.
And so, again, the deaths are all, can you please tell us the ages and just where they died? Like, was it all at the hospital in Kirkland?
We will follow up with you afterwards, and we will post information on our website with the latest. Our release does have information, the information that we have right now.
We have an updated document, sorry, that we have multiple documents because we're getting new information.
So,
Dr. Duchin, could you speak to the testing capacity that you expect to be working on other labs here? How many cases have been tested?
so this would be the final question, and then I have some closing comments. Jeff?
It's a couple hundred a day at the state lab right now. Yeah. So state lab is currently doing up to a couple of hundred tests per day, and they expect to increase up to perhaps 1,000 a day at some point. UW. And then UW also, UW is starting this week, today or tomorrow. They'll also be starting with perhaps a couple of hundred a day and then up to 1,000 a day.
And really, sorry, you're the state official, right? Yes. Dr. Is it total 6 deaths in the state?
Yes, the information, I think what people need to understand is we have 3 runs coming off. So our laboratory is doing runs to test for this virus 3 times a day. So at several time points during the day, we're getting new results. So as you can imagine, this information is really changing by the hour. I think one thing that we normally do during outbreak situations is we try to, come up with a time during the day that will sort of post, the latest information for that last 24-hour period, because it gets confusing when we just try to update things. And as you recognize today, things get reported from the hospital to their local health department, and then they get reported to the state health department. And it kind of takes some time for that to happen. So I apologize for the confusion.
So, and I appreciate everyone's patience and understanding as we get this information in real time. We will work to get you updated information as it comes out as soon as possible, because we know your deadlines and demands and appreciate your work. So thank you. So just some closing comments. we will be updating all of you on a regular basis. We do not have a next briefing scheduled for yet, but we will let you know when it does, and we will keep you updated as we learn about additional cases. So I thank you all for coming, and we will keep you informed. Thank you.
Okay.
Chase, are we done? Are we not in?